Hello, our dear viewers. Welcome to today's episode of Afya Health and Lifestyle interview series. On today's episode, we'll be talking to Dr. Nkata about health insurance, its importance in our health sector, and of course, how to penetrate the informal sector, which is by far the largest sector and also the least penetrated, that is with health insurance. Before I bring up Dr. Nkata, I'd like us to get to know him better.
Dr. Nkata is a medical doctor and health economist with 18 years experience in health system strengthening, public health programs design and implementation, and management consulting. He has played senior advisory roles on health systems reform to public and private institutions within the African region. He got his MBBS in the College of Medicine, University of Lagos, Nigeria in 2002. Diploma Public Health LSHTM, London in 2006. MSc Health Policy, Planning and Financing HPPF. London School of Economics LSE and London School of Hygiene and Tropical Medicine LSHTM, London in 2006. He also went to Stanford Graduate School of Business in 2021 to 2022. Dr. Nkata leads business and strategy development for HSCL, a health system and public health consulting firm, which he co-founded and has grown to presence in 4 African countries. Nkata is also the facilitator of the Health Policy Commission of the Nigeria Economic Summit Group, NESG, and a member of the Technical Working Group to develop Nigeria's Mid-Term National Development Plan 2021 to 2025 and Nigeria Agenda 2050. Dr. Nkata worked with KPMG as healthcare lead for Nigeria and West Africa between 2013 and 2015. While working with KPMG, he was responsible for building up the healthcare portfolio for Nigeria and Anglophone West Africa. He was also a senior member of the African Healthcare COE, contributing to visioning for healthcare businesses within Africa and delivery of engagements across the region.
Thank you for joining us today, Dr. Nkata. Welcome to Afya Health and Lifestyle interview series. We are really happy to have you. Today we'll be talking about health insurance and its importance. We are hoping that you'll be able to inform and educate us extensively on what health insurance is and how important it is for the Nigerian health sector to key into health insurance and to reduce the pay from pocket for health. So, Dr. Nkata, let's go straight to the point. What exactly is health insurance and how does it affect the Nigerian health sector?
Thank you, Remy, and Afya Health and Lifestyle series for inviting me to speak about health insurance, which is very important when we talk about health, access to quality health care when and where people need it. So health insurance, basically like any kind of insurance, just like the vehicle insurance that a lot of people are familiar with. It's really about prepayment. Insurance generally is about putting aside some payment that buys you protection for an event that is yet to occur, for a future event, and that future event is one that we usually have financial consequences, puts a financial burden on you, which in the case of healthcare, that financial burden can actually prevent you from receiving the care you need when you need it if you don't have the money, or you might end up spending such a significant proportion of your income or the resources available to you that you are either dragged into poverty, or if you were already in poverty or close to poverty, you get further impoverished. So with health insurance, like other forms of insurance, there is a premium, which is the amount you pay upfront, right? So you're not waiting until you're ill and then you go to a hospital and they charge you. you basically pay a premium. And typically, this premium is usually significant, way, way, way lower than what you will typically pay if you were to receive certain health services that are covered by that premium and pay out of pocket in the hospitals for that same period. And the reason is because premiums are determined on a population basis. So
Okay.
with insurance, particularly with health insurance, the key to it is that there is a pool of people, and within that pool, the risks are shared across every member of the pool. So the cost is also shared across every member of the pool. So when you buy into health insurance, you and every other person who's bought into that particular health insurance scheme are in a pool. The old, the young, the very healthy, the not too healthy, and all that. So it reduces the overall risk if you look at it per head, because there are a lot of people who are healthy who will probably not need hospital care in a year. And there might be people who might need treatment for malaria and typhoid and all that. And not so many people will, you don't have as many people undergoing surgeries as you have people getting treated for malaria and typhoid. So a surgery which is more expensive, the cost of the surgery goes into a pool and is distributed across everybody. So is the cost of malaria. So is the money for those who don't even access care for the period of that the premium covers, the 1 year or the period the premium covers. So the cost per person becomes lower because that pool creates what we call cross subsidization. The healthy subsidize the not too healthy. The rich subsidize the poor. The more productive and active subsidize the older. So the premium is usually way lower than even managing certain illnesses, just one episode of it. The premium you pay in a year typically will be way, way, way lower than just going to the hospital for even common ailments 2 or 3 times in a year. So, and therein lies the beauty of health insurance. The fact that you're able to pay this money when you're well and you're productive, because when you're ill, you're probably not going to work. And if you're not a salary earner, if you earn on a day-by-day basis, then you're not even making money to be taking care of your health. But with health insurance, you pay your premium ahead of time, and the premium covers a certain package of services that are well defined, and you will receive those services without any additional payment, except if there is a case of some co-payment where insurance covers up to a certain extent and then you cover a little bit of the rest. So in a nutshell, just in terms of trying to break it down, that's what health insurance basically is. And then I can speak to you about the benefits and how it's really the way to go for moving the health sector forward in Nigeria. Thank you.
All right. Thank you very much, Dr. Nkata. We'll come back to the benefit and how it is important in the moving of Nigerian healthcare sector to a preferred place where we'd want it to be anyways. But the way you've explained, um, I can tell from how you've explained that it is a very, very good idea. It is very sound and it is the way to go. But what do you think is the issue that has made Nigerians shy away from keying into such platforms?
So there are a couple of key issues. There are several, but the big ones. The first one I would say is trust. Over the years, growing up, those of us who are, you know, um, no longer we're Gen X now. So those of us who are, a bit older, and everybody older than us, there is a history where for years people's experience about insurance were either private insurance as people who never pay. You buy car insurance. The day you have an accident, insurance will find every reason not to pay you. The investigation will basically be going towards showing how it's your fault and how you've breached something that would um, absolve the insurance company from making the payment as promised, as agreed when you were buying insurance. On the public sector side, we've had social insurance packages that completely collapsed. People paid for several years, and they didn't. When it comes to getting the benefits, they didn't get the benefits. Similar to what we've had with the pension and all that. So that issue of trust, people do not. We need to do a lot of work for Nigerians to believe that if they pay money up front for health, that when they actually need the health services, it will be provided for, and people will not come up with stories. So trust is one. The second issue is the services, the healthcare services that are actually available. Where are they available? What is the quality of the service that is available? Early days of health insurance, again, the experience people had was they go to a hospital and they are diagnosed with a malaria, just as an example. And there are certain malaria drugs they are used to, that they prefer, that they feel works better, but they are given a malaria medication that they feel is the cheaper one, and they are told, oh, this is the one that your insurance covers, and then they see people paying out of pocket, receiving the other drugs or other kind of services. Again, that created that impression that, oh, when you buy health insurance, you get inferior, in quote, services. So I
Services.
think trust and guaranteeing people that they really get the best quality care for when they get the care. They trust first that they will receive the care they paid for. It's not a case of when it's time, they say the money has disappeared, the pool is no longer there, and all that. That's number one. And this comes from years of not too good experiences with insurance in Nigeria and other public sector protection, other public protection schemes, pension and others, housing fund and all that. So there's the trust issue, and then people knowing that even when the service is available and they receive it, that there is no discrimination in quality between those who have insurance and those who don't have health insurance. And that's the work all of us in this space are trying to do, to make sure that there is that supervision, compliance, and all that to protect enrollees, those who have insurance, to make sure that they receive the right quality of care, and then to also make sure that the pools are ring fenced and the money is available to pay for services when any member of the pool needs it. Because once that breaks, it's a compact, it's a mutual compact between the enrollee and the insurer, and then the providers. So once there is a break in that chain, that's what creates problems. So and those are the things that the new wave of health insurance programs from the national to the state level are trying to address, to say money must be ring fenced. The money in the pool for health insurance, if you buy into a government health insurance scheme, that money should never be used for roads, even if there are no roads anymore in your area. No, it's not money for roads. It can never be used for feeding people, even if everybody is starving, because it is
So,
money meant for health. That pool has to stay there and be ring fenced to deliver on the package that people have been promised. So thank you.
all right, thank you very much, Dr. Nkata. You've just stated now that the new insurance system from the federal government to the states and probably even the private ones are trying to solve the problem of trust and also the breaking of the pool in such a way that the money is intact for and used when the health needs arises. How then can we now ensure that Nigerians know that this new development, that the problems they've been facing in the past has now been solved and they can trust the system more? In other words, what are we doing now to inform the average Nigerian that, oh, we understand the problems you used to have in the past. It is different now. You need to trust us because we are your best choice.
Yeah. Well, the best form of advert is actually showing results. When beneficiaries
That is true.
speak up and say, hey, this is what it is. In the States, I work with a development consulting firm, Health Systems Consult, HSCL, where I'm the founding partner. We've supported a couple of states in Nigeria with either design or operationalization of the health insurance schemes. Delta, Lagos, Kaduna, Niger, a bit of work in Bauchi and Yobe as well, all around health insurance. And one of the key components we always push with any of those states we've supported from the onset is to have a demand generation strategy. Because no matter what it is you're doing, given the place we're coming from of lack of trust because of systems that were broken in the past, you need to communicate enough. Like there is no overdose for demand generation. People need to know what services are in your benefit package, where they can receive those services, how much the premium is, and where they can buy the insurance and how they can pay the premium. People also need to know what you have put in place that makes this different from the past. If there are laws like we have in a lot of the states now that ring fence the money, you need to say that. People need to be clear. People also need to be aware of where to lodge complaints if they do not feel well treated, or they have issues with the services. Where will they lay complaints? That's one. So the whole demand generation thing, formal, structured, traditional media, new media like social media, interpersonal communication. You need to go out to the market. If you need to organize masquerades to dance, to put people together, to deliver the message, you need to do that. So a significant part of the investment is around demand generation. That's one. The second one is you really need to deliver on what you promise and make champions out of your beneficiaries. If one person who comes out and says this insurance is rubbish, I went there, they didn't treat me well, will undo 5 years of demand generation work. The same way one person who comes out and says, whoa, this is the best experience in life, it saved my life, it saved me money and all that, will again carry more weight than just running radio jingles. So you need to run the standard demand generation, but the biggest strategy is really to make champions out of the enrollees. And the only way you can make champions out of the enrollees is as the health insurance agency or the health insurance organization, in terms of in the case of a private organization like HMOs and all that. You really need to have a mechanism that ensures that providers are motivated. You have the right contractual agreements and incentive packages for providers to deliver best quality service to your enrollees. And then you pull as much of those enrollees as possible that are willing to speak out, to make them the face of the insurance scheme, to make champions out of them. And I think one of the ways to do that, you see, with private sector, organized private sector, it's a bit easier because the National Health Insurance Scheme Act that set up NHI makes it mandatory for anybody who employs more than 5 people, right, to ensure that they have health insurance, public and private sector alike. So it's easier to enforce that with the public sector, where government will just deduct straight from your salary, put its own, and pay the insurance agency, and the organized private sector, where the companies don't want to run foul of the law, and they all know a bank, a consulting firm, another company, how many staff they have and all that. But over 70, I think 80, yeah, about 86% of Nigerians or thereabout who are employed, those who have any form of employment, are employed in the informal sector. And that's a sector where it's difficult to know how much people earn. So if you want to take a percentage of the salary, you first need to know what their income is, right? And how do you track them and all that. So for such people, you need to very quickly make champions out of informal sector leaders. Your market women associations, your road traffic, road transport workers associations, your Okada riders associations, your Alaba market, the guys who sell power products and all that, the leaders of these groups, you should be your primary target for demand generation and enrolling into the scheme so that they can actually speak to others. So that whole structured demand generation, deliberate strategy for targeting the informal sector and making champions out of enrollees who have benefited from both the formal and the informal sectors, is key. And you can only do that when you actually have your finger on the entire insurance value chain, from collecting the money, pulling it properly, to contracting providers in such a way that the provider is well motivated to deliver the right services, and building a feedback system where you get people who have received services, to become your champions, basically, your flag holders, and that's the way to go. It's a long journey. It's a marathon. It's not a sprint, but we do not have a choice. We absolutely have to do this. Yeah.
So, Dr. Nkata, before we go into how insurance needs to penetrate the informal sector, that is, it being the largest market and also the most difficult to penetrate, I want us to talk about the recently inaugurated Lagos State Health Insurance Scheme. What is the purpose? How does it function? What is the importance of this scheme by the Lagos State government to a woman out there that sells gari, or the man out there that is a barber?
Yeah, thank you very much. So the Lagos Health Insurance Scheme, it's relatively new, but what happened a few weeks ago, and in fact, what's been happening over the past couple of months, the last 1 year, is a relaunch and a rebranding. We've been working, HSCL, we've been working with Lagos State, supporting the state to ramp up capacity, build the systems and the structures and all that to quickly ramp up enrollment, operationalizing the scheme, because Lagos, as you well know, has a population of over 20 million, so there is a lot of work to be done. So what Lagos has done in the past 1 year is basically to rejig and rebrand its health insurance scheme. The health insurance scheme law, the Lagos State Health Scheme Law was actually signed in 2015, and I think the insurance itself was formally launched in 2018, I think. Yeah, 2018, I think. Yeah. So it's not, like I said, it's not new, but it's now being rejigged into what we would call Ilera Eco, with deliberate branding. And it's part of what I was mentioning about being deliberate about targeting the bulk of the population who are in the informal sector. So rebranding the Lagos State Health Scheme as Ilera Eco is actually a result of engagement with different subpopulations in Lagos, artisans, bankers and all that, and coming back to sit to translate the insurance into language that people can relate with, so that's the rebranding as Ilera Eco. And since that rebranding as Ilera Eco, there's been very active drives to penetrate the communities. The Lagos State Health Management Agency, LASHMA, that runs the Lagos Health Insurance Scheme, Ilera Eco, now has an informal sector enrollment strategy and are placing community-based enrollment officers in communities whose work is really to target community people. And these are people from the communities who are known, and they have this kind of performance-linked payment, that motivates them or incentivizes them to, bring in as many people as possible. They speak the language, they live with the people, so they're marketing the insurance. There are now registration kiosks in communities, well branded. So the whole idea is, um, you know, over the next couple of months and years, once you see the logo or the sign anyway, this is an Ilera Eco place. This is where I can go register for health insurance. This is where I can complain to someone. The hotlines are there where you can call and all that. So it's basically a rebranding to give it that push, that makes it more acceptable to the man and the woman on the street. And then 2 weeks ago or 3 weeks ago, Lagos launched its new benefit packages. They already had existing benefit packages, but they did a review, which we in HSCL we supported them, conducted an actuarial study, looked at additional services that can be brought into the package for the same cost. And the premium for the Lagos Health Insurance Scheme is 8,500 naira per person per year. So you can imagine for a whole year.
Wow.
And the package is huge. I would encourage that Afya gets a copy of the benefit packages and you put it up on so that people see the sheer number of services, health services you can receive. And now they've even expanded that a bit as a result of this work we've been doing with them, doing the actuarial studies, and they've now expanded it, included family planning, even some HIV and TB services, and a whole lot of other things. And then they've gone ahead to also develop some bigger packages for people who, in addition to this very robust basic package that goes for 8,500 naira per person per year. This is less than 1,000 naira a month we're talking about. They've now also created 2 additional packages that even have way more services. For those who also want the more expensive diagnostic test and they have an additional package that costs more. I think it costs about 15,000 per annum, which again, just look at it, 15,000 again. That's just slightly over 1,000 a month.
Yeah.
And then they have what they call a diaspora package, where Nigerians in the diaspora, instead of always panicking over your aged parents or your loved ones in Nigeria and sending them money to go to the hospital, you can just buy them insurance, and for that one, they have accounts where you can do direct transfer from UK, US, and all that, and buy your parents or your kids or your loved ones in Nigeria insurance, so that when they call you, they are just saying, well, we've received care in the hospital, we're fine, rather than we're in the hospital, can you send $200 or $500? And again, like I mentioned, the premiums are way lower than if you were to walk into a service to pay. There are very few things that will take you to a hospital in Nigeria and you spend less than 8,500 naira, and that's premium for a whole year, you can imagine, for several services. Yeah.
Wow. I'm saying wow because looking at all of the packages that has been well thought of and has been added into this scheme, average man and woman out there would really benefit a lot if they join the scheme. It doesn't matter what level, be it the very more robust package or the basic minimum package. It is really a very well thought of and a good one. This is Lagos State. What is the plan for this type of scheme for other states? Because at the end of the day, we can say that Lagos is probably the most urban of all of the states. So those states that are more inland and all, what is the plan for them? Because I am very sure this type of scheme will be very beneficial to them too.
So, Remy, as at the last count, basically every state in Nigeria and FCT have passed a law, a health insurance law, similar to what Lagos passed in 2015. And I think about 31 states are setting up or have set up their health insurance schemes. So this is not happening only in Lagos. Lagos, like I said, has rebranded, rejigged its insurance. It's creating a lot of visibility, which is the right thing to do. almost every state in Nigeria now is at some stage of operationalizing a health insurance scheme. Most have their laws passed. I think all actually have some laws in place. Of course, going from law to implementation, it's not exactly easy. States like Delta, Anambra, Kaduna, Niger, Kano, Ogun, relaunched its scheme just a few months ago. That had the head of NHIS and all that in attendance. So this is a nationwide thing that is happening. The same way I spoke to you about Lagos, I can tell you about interesting things happening in other states. And I'll give you an example. Delta, for instance, Delta has the highest number of enrollees for any state in Nigeria. They have over 1 million enrollees. Yeah. Anambra has this very interesting strategy of adoption. The Anambra Health Insurance Scheme mapped the billionaires in Anambra and created a database of over 1,000 billionaires who are from Anambra State, and developed this strategy where they are reaching out to them to adopt people for health insurance. So besides providing foodstuffs and paying people's medical bills and all that, right? You can adopt your community, you can adopt 10 people, you can adopt 50 people, and you pay their premiums every year on a year basis. So states are coming up with very creative ideas. There's a lot happening, So Lagos with the rebranding and the rejigging under Ilera Eco, it's amazing. Like, that's why the visibility now, like, it's really out there, and I pray that it continues to grow, because Lagos has a lot of work to do given the population and the demographic, the mix. You have urban slums, so it's an urban city, but it has its own challenges. But then you have several states. Kaduna has over 300,000 enrollees as at the last count. And this last count, these are figures I have from like 2 years ago. So FCT is enrolling every day under the FCT health insurance scheme. So almost every state in Nigeria, even those who have not started enrollment, probably are setting up the structure for the agency or commission that would anchor that. There is something going on about health insurance in every state in Nigeria, that I can tell you categorically, but they are all not at the same level. And we're hoping, and we're also trying to create opportunities and platforms for cross-learning across states. I remember there was a time the people from Bauchi went to Delta, some other people have gone to Lagos, and people keep moving. We went to Rwanda with the Lagos state team, took a look at. So we're trying to encourage a lot of cross-learning so that states that are just starting up can learn from states that have already started. There are challenges along the way, but just so that you don't reinvent the wheel, and you can already take solutions from other people's challenges and not have to live through those challenges yourself. So this is a nationwide movement. Yeah.
All right. Thank you very much. This is very refreshing to hear. Looking at this very, very detailed and insightful information concerning the health insurance that many people do not know, it is really important that we continue to invite the likes of you to different platforms so that more Nigerians can be aware of what is going on and how to make their health better just by putting in a little amount here and there and have a robust health insurance. Before we end this interview, sir, what advice would you have, or would you like to give the average Nigerian? Because at the end of the day, I think it is about time we stop the pockets payment from pocket for health issues. It is really, really bad for the health sector, and it is really, really holding us back. So what advice do you have for the average Nigerian, especially the informal sector?
Yeah. So I think we need to realize that health insurance is for our own good. We can talk about the things that government has done well and has not done well over the years and all that. We can talk about the things that health insurance companies or generally insurance companies have not done well over the years. But health, first of all, our health is our responsibility, in as much as it's also a right from government who we entrust with our taxes, and with our common resources to manage on our behalf. But it's primarily a responsibility. So just like we take that responsibility to brush our teeth in the morning, to make sure we don't have an open wound, is the same way we owe it to ourselves to ensure that we're not denied healthcare when we need it because we don't have money in our pockets. And the best way is prepayment. If one insurance company or scheme does not work for you, find the one that works for you. Nobody's saying you must buy John's insurance versus Adamu's insurance or Remi's insurance or Okonkwa's insurance. No. But make sure you have health insurance. The same way you should make sure you have vehicle insurance if you have a vehicle and you drive on the road. Nigeria. Last week I was in Ghana for an ECOWAS high-level summit on universal health coverage, organized by West African Health Organization WAHO, and I was sharing some lessons around UHC and looking at the UHC situation. Nigeria has the highest out-of-pocket payment for health in all of Africa, as in way over Chad, Niger, Sierra Leone, Liberia, countries that even the ones that just came out from wars not too long ago. We have out-of-pocket payment of over 70%. Like our total health expenditure in Nigeria, over 70% of it comes from individuals paying out of pocket. We have by far the highest in West Africa and in Africa. So it's not a place we should be. Government needs to do its bit, push out the message, create insurance schemes that, provide the right level of trust and quality. But we as individuals also owe it to ourselves that responsibility, to actually seek out, of all this noise around health insurance, which one works for us, which package works for us, which one is within our reach. We cannot claim that the premium is too high. For instance, if I take Lagos at 8,500, there are people who can afford that, and the state government puts 1% of its consolidated revenue fund into a pool in Lagos and Delta and a lot of these states to pay for those who really can't afford it. But most of us are able to drink Coke and buy recharge card and eat pepper soup of more than 8,500 a month. So it's really prioritizing our health. There are way more Nigerians who can afford these very low premiums as against the Nigerians who can't afford it. If you look at our consumption pattern and the things we spend money on, it's really a matter of priority. But besides talking to us Nigerians, I think government and the insurance agencies owe it to us as a duty to really make this information available to everybody, because there is also a lot of hesitancy that comes from ignorance, from people not having the right level of information. And lastly, like I said, though the insurers, be they public agencies or private organizations, must make sure that people receive quality health care within those packages they've defined that people pay for. Otherwise, we'll be undoing the system. Thank you very much.
Thank you very much for joining us, Dr. Nkata. We are really happy that you joined us, and very appreciative of the information you have given us today. And hopefully, Nigerians will key into a lot of this health insurance scheme so that we can have a better health and a better lifestyle altogether. Thank you very much for joining us.
Thank you, Remy, and well done to you and your team at the Afya Health and Lifestyle series. Thank you.
Thank you, sir. Yes, sir. So, dear Nigerians, you've heard it directly from Dr. Nkata. It is important that you are on a health insurance scheme. Paying out of pocket for health is very, very bad, and it is a poor financial decision. So why not put in that little here and that little there, so that when you need this health, when you need to take care of your health, all of this put together will give you a better and more adequate health management. Thank you for joining us on Afya Health and Lifestyle interview series this week. Do subscribe and follow us on across all our social media platforms. We look forward to seeing you next week, same time. Thank you for joining us. Have a great day.